It's like some of the things when I was coming to the US, they paid for my plane ticket, but
Hi guys, welcome to my channel again. It's Priscilla Kuma, BSN RN, based in New York State of America. I am a nurse who trained in Ghana, worked in Ghana before moving to the US. And you know I'm a YouTuber. I have nursing videos for you, travel, lifestyle, interviews. And as usual, I have somebody on the seat. First of all, let me just say that I apologize for the picture quality, apologies for the sound, but I hope the message will be clear. And I'm feeling much better now, so hopefully you can hear me clearer. And if you are trying to work in the US and you don't know where to start from, this video, you shouldn't miss any part of it. It's going to be in 2 parts. Make sure you watch part 1 and part 2. This is a success story of somebody who went with one of the agencies and finally made it to the US here and have been living here with his family, and he's been working in America, and he's going to tell you about what he did, how long it took, how his family came alongside, and how life has been since he arrived. And working in America health setting, how different it's been from Ghana. So if you're trying to find an agency and go with them, listen to this, watch it, share with others, and I will see you at the end of the video. Hi, Eddie. Welcome to my channel. Welcome to Host It with Priscilla.
Hi, Priscilla.
How are you?
Oh, by the grace of God, everything is going on. So far, so good. I can't complain. So far, so good.
Yes. Officially, I want to welcome you to America. I'm so happy for you.
Yeah, thank you. Thank you very much. I think it has been a long time since we planned having this meeting, and finally we've been able to have this meeting. So I'm very happy that I am part of the I was chosen to be part of your crew today, to be the one speaking on your channel today.
Thank you very much for making time. I know you have a busy schedule, you just got off work, but you're making this possible. So I'm very grateful. So just quickly introduce yourself to my viewers. Who are you? What do you do? How did you end up in America? Then we'll talk about the process. So just a brief introduction of yourself.
Okay, I am Edmund. I'm a registered nurse. I completed University of Ghana, I think 2011. Yeah. I worked in Ghana for a while in one of the biggest hospitals in Ghana, and I had a chance to come to the US. I'm currently working as a registered nurse in the US, in Kansas, in one of the, I would say, big hospitals here. So basically that is what I would say. A registered nurse working in Kansas, in one of the biggest hospitals here. That is what I would say.
That's very nice to hear. So, number one, what motivated you to leave Ghana and practice in the US? And what process did you use to arrive in the US?
Yeah, so leaving Ghana, I think it was more or less like I was looking up to just looking for opportunities to explore. You know, I found myself in the nursing profession. I worked for 8 years, and I was looking for something challenging. Whilst looking for that, I was also looking at something that has to do with my personal development, and something that was also going to help my family. So it wasn't just about my personal goals, but I also considered my family. So when I had this opportunity, I said, hey, let me just grab this opportunity. And I think this will help me to achieve the goals I want to achieve in life. So I think it was more or less like a personal and a family goal, something that was going to help me and going to help my family too. So with the process, I think I had a couple of friends who I spoke to, and they told me that, hey, if you want to be a nurse in the US, there are several ways you could be. back in the days, we didn't have those kind of information. And so when I spoke to my friends and they told me that there are so many agencies out there who help nurses, so they told me about Avant Healthcare Professional. So that was how it started. That was how it started. That was how it started. So yeah, so with the Avant Healthcare Professionals, in actual sense, it was supposed to take a maximum of 2 years for the process. I think as we go on with the interview, I'll break it down, but it was supposed to take 2 years. But, COVID came in, the issue of COVID came in, so it had to delay because we had so many countries closing their borders and making the immigration aspect so difficult. So because of that, there was a delay. There was a delay in the process. I think I was supposed to use 2 years, but it was almost 3 years for the process. Yeah.
So if somebody watching this now wants to apply to Avant, what is the process? What did you have to put together? Did you have to take an entrance exam for Avant to accept you? And how did they have to prepare you, train you, and all that?
Yeah, so I would say that the process is in so many phases. I would say, first of all, you have to sign up with Avant. You have to go browse on the net, look for their website, and do an online application where they will ask of your name and some information about you, some piece of information about you. They will ask you about your work experience and your resume. So when you submit it to them, they would have to scrutinize it. They'll call you and just to make sure that whatever is written on the resume is something that you wrote. They just want to confirm that. And so that is just one aspect of it. And you also have to do something like an entry exams. They would want to test you that you are supposed to meet a certain mark. So once you do that test, one is more clinical, that has to do with the work we do, the nursing profession. And the other one is the English proficiency. So you are tested on the clinical aspect and you are also tested on the English proficiency. So once you are able to pass that, that doesn't guarantee. They also have to do an interview like I'm talking to you. They are going to call you. And based on whatever information you gave on your resume, they are just going to ensure that you have adequate knowledge on whatever you presented on your resume. So after going through all this process, another thing they also look out for is the hospital you work. The hospital must meet a certain criteria with it should be more or less like a multidisciplinary teamwork, something that has to do with not limited to those I would say small hospitals, but they wanted hospitals like those teaching hospitals in Ghana, those regional hospitals that have large bed capacity, and something that has to do with specialties, like neurosurgery. We have the neurosurgery, we have orthopedic surgery, we have, something that has to do with multiple disciplines, like something like that. So they just look at all this. So once you meet all this criteria, then you would have to sign a contract with the agency. They will just write to tell you that they have picked you and you meet their criteria. So you have to sign a contract. That is just the first aspect of the process. Okay. Yeah. So the next thing would have to do with preparation for the NCLEX. They would have to prepare you for the NCLEX, and I would say the NCLEX is one of the most difficult exams, if not the most difficult, is one of the most difficult exams I know people write all sort of nursing exams. Some even use 1 month, some use 2 months. But here, I bet you NCLEX is very, I would say, difficult, but it's not something you can't do. Let me put it that way. Yeah, so they have to prepare you for the NCLEX exams, and with the NCLEX exams, whilst they are preparing you for the NCLEX exams, they would also be working on the CGFNS applications. So it's like they are both working together. So once you get a CES report and you get your attestation to test, that is when they will schedule you for the NCLEX exams. And preparation, sometimes I would say, all things being equal, it could take like 6 to 9 months for the preparations for the NCLEX exams. But sometimes your input also affects how quick or how slow, how soon you'll be taking the exams. If you are not able to meet the deadlines, the dates for assignments, dates to do your test, it's actually going to prolong the time that you have to take it, because the agency would also ensure that you meet a certain criteria, you've done your test. They have to ensure that once they are taking you, they are preparing you for the exams, they have to make sure that you'll be able to pass. You should be able to convince them that you'll be able to pass before they book a date for you to go and write the exams. Yeah, so I've had some friends who have taken longer than the 6 to 9 months I was talking about, all because they were not able to meet the criteria, the score that the agency wanted. So I would say that once you've made up your mind that you want to start a process, you have to quit almost everything you are doing just to concentrate on the process so that it goes as it is planned. Yeah.
So you've spoken a lot, you've covered most of the questions, but you mentioned some technical terms, CGFNS, CES, ATT. Do you want to break those things down? What is CGFNS? What is ATT? What is
Yes, I think this I'll just throw just I wouldn't speak much about it because I know you have other videos where you talked about those things. So the CGFNS, I think it's more or less like a body that kind of regulates the nursing profession in the US with some states, because I know it's not every state that has a CGFN. I pick people with who have been certified by it's more or less like they go through your background to check that you meet the criteria to be a nurse in the US. So they will look at your PIN, they will check your nursing records, they will check your PIN just to ensure that you are an actual nurse from where you are coming from. They also look at your education background. So they will send documents to the institution, your nursing institution that you attended, just to ensure that the programs you did at a nursing school qualifies you to be a nurse in the US. So that is basically what I would say about the CGFNS. They also look at your senior high school and all that, but I think that your nursing school and your the nursing profession with your PIN, those are the main things they look at, and your educational background. Yeah, those are the main things they look at. And after going through the CGFNS, and they also realize that you meet the standards, they normally, whilst doing the CGFNS application, you have to register with a state board. So we have a Texas board, we have almost every state has a board of nurse, and so the CGFNS will release the CES report to that state, and the state will also do their own investigations or whatever. They also have a criteria you're supposed to meet, because I know for Texas board, where I did originally, you're supposed to pass their jurisprudence exams, and you also have to submit your fingerprints and all that. So once you have everything sorted out, you register with Pearson View. Pearson View, they are the ones who schedule you for the exam. So I think your Board of Nursing will release the attestation to test, after which Pearson View you can schedule and go and write to the exam. So it's a whole process, it's a whole process. Yeah.
So did the agency have to do all this paperwork for you, or were you dealing with the CGFNS as an individual?
Yeah, so with Avant, I think most of the work were done by the agencies. I don't know. I think they keep changing some of the things they do. But when I was with Avant, I think almost all the CGFNS stuff were done by the agency. What I had to do was, after they were done with the CGFNS registration and they paid for the CS report, I had to send those documents to my nursing school. And I also had to send to the Nursing and Midwifery Council in Ghana. I had to take that aspect. You had to do a physical presentation of those documents to them. So I think with that aspect, I did it, and you would have to pay for those verification processes. Yeah.
Do they have a physical office in Ghana where you can walk to, or everything is online?
Yeah, everything is online. When you look at the US and Ghana, those are some of the differences you see in the system. From where we are coming from, we are used to physical offices where you have someone, but I tell you that they don't have an office in Ghana, but the way they communicate to you or communicate with you, it makes you feel like they are just at your back, like they stay just with you, because phone calls, emails, every information that you are supposed to get, they provide you with all those kind of information. So they don't have any office in Ghana, but the main headquarters is in Orlando, Florida. But you would have a representative. Like when I was doing Avant, I had someone who was in charge of my every aspect of the process. So if it has to do with an immigration, I have someone who was someone I could link up with. If it has to do with licensure, there's someone who is also handling that. So at every stage you get to, you have someone who handles that aspect. Yeah.
That's very good. I think what we, as you said, we are not used to doing anything online, checking emails, replying emails, filling forms online. That is why most people are afraid to take the step. As soon as they log on, as I log on, go to their website, read this. They go back, they go there and they come back like, I can't find whatever you are saying. The form is complicated. I made a mistake. It's high time we learn to do everything online. That is it. So did you have to pay a fee before you started the process?
With Avant, with Avant, there was nothing like a fee. There was nothing like a commitment fee or anything. There was nothing like that. I didn't pay anything. I just did, like I said, did the exams, did my interviews, and when I met the criteria, I was picked. I signed my contract, prepared for the NCLEX. There was nothing like a fee. I didn't pay any fee. Yeah.
Okay. So you guys have heard it. Don't go and pay any fee for any or any. Start the process and deal directly with the right agency. So after them working with CGFNS and getting all those paperwork, were you preparing for NCLEX alongside? Did they give you a tutor? Were you doing online classes, assignments, or how was it? Were you in a group?
Yeah, so I think that is one, I would say that with a process, that is the most difficult aspect of the process. That has to do with learning. I was a nurse, I was working, so I had to combine working with learning. So it was very difficult. One thing I said to myself that time was, hey, if this is what you want, then you have to stop almost every other thing you were doing. Personally, from background that Edmund is someone who always want to explore, doing a lot of stuff. So I had to quit so many things I was doing just to make time for the exams. Yeah. So It is, I would say it's 100% online. It's 100% online because they will buy. I remember when I was learning, Avant had us register with Leaping Courts, and that was our main study materials that we were using at that time. They also gave us sounders. They posted sounders to us. They also posted some reading materials and some pharmacology materials that we also studying. So it was more or less like, it was a very tight schedule because there were deadlines. This week, this is what you're supposed to do. This week, this is what you're supposed to do. So it was like almost every time there was something to do. Almost every time there was something to do. You know, when I came here, then I understood it, because in the US, there's nothing like just going to school. When you go to the workplace, you realize that they are schooling and they are working at the same time. But so I said to myself, when we were in Ghana, I went to the nursing school for 4 years. I never did any work when I was doing that, which is kind of weird over here because almost everybody is schooling and working at the same time. So to everybody or anybody who want to start this process, you should understand that you have to put in more work, because aside the number of hours you are supposed to work, you must also make time to also read, do tests, do remediations, and all that. And I'll tell you, I didn't even limit myself to what the materials Avant also gave to me. I had friends with other agencies that we used to do group studies, we used to do group discussions and all that. So it was a very tight schedule at that time. Yeah.
So I forgot to mention, Edmund and I were in the same class in University of Ghana, the premier university, for 4 years. We're in the same nursing school. Yeah, so he's my colleague. We go way back. This is more than 12 years. We've been yeah, and he is one of the brilliant students, and he likes to be very how like we say, hardworking, very trying to look for the next big move. So for Edmund to be able to do this study alongside all his busy schedules and side jobs and side hustles, that means you can also do it. You don't have to quit your job to do it, because some of the agencies, the requirement is as soon as you start the process, you should still be working with that facility. They want you to remain there through the process. So you can't stop your job and stay home and study. You have to study alongside. Even those of us who are working full-time in America, you go to work and work is like you're still back in school. There are so many modules they upload on your work site accounts, where you have to study and keep up with the current stuff happening. Every day there's something you have to study, the new changes that have come, the new equipment they have brought online. Like, am I a student or am I a worker? Because the modules have deadlines too. So you have to do this by 6 weeks time. If you don't, it's going to be turning red and beeping, and your nurse manager is going to be coming after you. So you'll be working and you still be doing work, online stuff for your job. And girls do that. They're working, they're doing all the work stuff alongside, they're doing their master's program and they're running family and all. So if you are determined and you put your mind to it, you make it. So how long was the training, the online preparation? Was it 12 weeks? And the books you talked about, did they mail the books to you physically? They gave you hard copy books, or they uploaded it online?
Yeah, so what happened was they asked us whether you want the soft copies or you want the hard copies. So some people chose hard copies, others also chose soft copies. So depending on which one you are comfortable with, that is what they do for you. And personally, I started the process in September. I think it was September 2018. September 2018. Yeah. September 2018. Yeah. And I was supposed to write in April 2019, but I had a problem with the CGFNS process. I think there were some things that needed to be clarified. So it shifted my date to the last aspect of July. So they had to postpone my time. So those are some of the things that come in. So that is what I would say, all things being equal, because I know somebody who started this process, and the CGFNS aspect is taking like 12 months just for that aspect. So it has to do with lack, should I say lack, or CGFNS accepting your documentations and everything. Yeah, so that is it. That is it. I was supposed to use like 6 months to read, but I ended up using like 9 months for the preparation for the NCLEX. So I would say, even though my time was postponed, but I think it was a good thing because it gave me more time to read. It gave me more time to read because I had like April, May, June. I had like 3 extra months. So that was when I realized that everything happens for a purpose. So the 3 months I had, I just had to put in much effort, and God being so good, it's everything went on as planned. Yeah.
So they don't give you like a timeline. Let's say we'll take 2 weeks and do endocrine. We'll use 1 week and do maybe another system. They didn't give you like 24 weeks. We have to finish this curriculum or this packet. They didn't give you any timeline like that.
Yeah. So I think I would say with Avant, with my time, with it wasn't more or less like a systemic something, like systems. We are doing system by system. I remember I we used to have discussions, or everything was meshed up. Like if it has to do with safety, with the NCLEX, we have the safety aspect, we have the physiological integrity, we have those kind of divisions. I think that was what we're doing. That was what we're doing. So it wasn't like a systemic something. Yeah, but I would say that was just with them. But I tell you, Priscilla, the work I did outside what Avant told me, I think was twice what Avant did, because I was going by their study plan, but I also made time for personal stuff because they are not going to train you like you are now starting nursing school. It's more or less like a revision something. So what it means is that if you don't understand something, you would have to go back and start afresh and get to understand it. You understand? And the US setting is different from the Ghanaian setting. That is what I would say. The US setting is very different from the Ghanaian setting. So you, irrespective of how brilliant you are, you still need to go through the process. You still need to go through the process. Everything is, the nursing we do here is different from, and I'll tell you that everything that is done in the books, about 90% is what is done at the hospital. It's not different from what we do in the book. So, and there's nothing like oh, I just I'll tell you that, but I'm just trying to remember. It's everything you see when you come to the hospital setting is there. There's nothing like improvisation. That is that's the words I want to use. There's nothing like improvisation over here. Yeah.
Going to come to that. Towards the end will be the difference between nursing in Ghana and nursing in US. So reserve that aspect for towards the end. So when do they feel like you are ready to go and take the boards, the NCLEX? Do you tell them that you are ready, or based on how you are performing on your assignments before they think you are ready? And which places can somebody in Ghana go take the boards? Which countries are the nearest NCLEX centers?
Yeah, so you can tell them you are ready, but you telling them you are ready has to do with your score, with the preparation, the exams that you'll be doing. So if you are getting like 40%, 30% in your test, there's no way you can tell them that, hey, I'm ready for the exams. Your talking should be from your performance. So once you are getting 60s and 70s, or you are doing well and you meet their criteria for selecting people who are ready for the exams, they will let you know. But the talking should come from your performance in the preparation stage. And in my time, I had to travel to India to write the exams. There was no test center in Africa. But as at now, I know that people are taking it in South Africa. You don't have to travel all the way to India to write the exams. Yeah.
Oh, as you can hear from Edmund, he is a success story of Avant, and he's not alone. He made it to America with his entire family. So that is also a package. You come into that aspect. So if you are still doubting, is this Avant thing real? Is it a scam? This is the living evidence of somebody who went through the process. His process took longer due to COVID and document delays and all, but he made it here at the end of the day. One thing I want to say is that whether you do it or not, that time is going to pass. Anything you want to do in this life, whether you go to that school or not, the time will pass. Whether you do the marriage or pursue the academic, whatever, the time will pass. So if you want to think, oh, it's going to take 2-3 years, I'll just forget about it. No, the 3 years will come whether you've taken it or not. So therefore, let's say they felt you were ready, and then they reached out to you and made all arrangements. How was it moving from Ghana to India? Did they pay for the tickets? Did they get your hotel, food? How many days did you stay in India? How did you go alone? Did you go in a group? Just a brief summary of your journey.
Yeah, so I think that is also another aspect, another challenge. So I was there, they just sent me my ticket. So they'll just ask where you are, the nearest airport to you. You know, I was in Kumasi then, and so they booked a local ticket, the local flight from Kumasi to Accra, and another one from Ghana to Ethiopia, then Ethiopia to New Delhi. I wrote in New Delhi, the capital of India. That was why I wrote the exam. So they paid for the hotel, they paid for the flight, but with the feeding, I think the hotel that we're in, they gave us only breakfast, so we had to get our own lunch and dinner. Yeah, we had to. So definitely we had some stuff in our packs when we're going there. We had to take some food and other things when we're going there. And they never told me that I was going to write with anybody until I got to New Delhi. That was when I realized that I was actually moving from Ghana with one person who was also going to take the exams, because I got to New Delhi and the one who was supposed to pick me, I realized that he was having a plaque with my name on it and another lady's name on it. So I was like, no, this name is like a Ghanaian name. So I was like, hey, who is this other person?